to our next session on oral cancer with Dr. Pranay Pardesi. I'm Dr. Neetika Modi.
I'm Dr. Madhu Chopra, and we are bringing to you a series of eye-opening advice, suggestions on subjects that you will be amazed how little you knew, how little you know. So today we have Dr. Pranay, and he's going to elaborate on oral cancer.
Pranay, let's take from where we left off last time. So while we were talking about the different factors that could cause oral cancer, and we focused on tobacco and alcohol. In the mouth, the environment in the mouth, often, we have semi-erupted wisdom teeth, some very sharp wisdom teeth that constantly cause cheek bites, and the patient begins to live with that little white strand in their mouth. That could be a causative factor too, right?
Absolutely. So any sort of constant trauma happening in the oral cavity with maybe some sort of predisposing factors like some sort of systemic disease like diabetes, where the healing potential has already gone down of this patient, so can cause cancer. And especially the people who are clenchers and bruxers, you will see these teeth, they get worn off and they become really sharp, and because of this they create small ulcers on the tongue which do not heal. And it's not once or twice if it causes any sort of ulcer would not will cause cancer. It's not like that, but constant trauma in the same area again and again may lead to cancer.
So there was this case, I remember you've also seen this patient we had. No habits, no trauma in the mouth, nothing. And she landed up with this huge cancer of the tongue where we had to operate half her tongue. What would you attribute that to?
See, this could be a few things like there are some genetic predispositions which are already present, and it's a proven fact that genetics do play some roles in this. And
even cancer of the tongue, oral cancer.
So if your body, if there are no positive known factors, and genetics need have some sort of role in it, even in oral cancer.
So अगर कुछ नहीं पता चले तो blame it on genetics. Both her parents don't have cancer. Now we don't know. We know that her grandparents haven't had cancer. So I mean, that brings us back to that.
Is there something in the DNA? Is there something in their
mitochondria?
Yes.
No, something we are missing. Perfect. So there's a missing link somewhere in cancer. So do we go back to the oral phase that cancer is karmic and we don't know, we still haven't found?
So research is still on. We are still, oral cancer especially, how much ever we have researched, but if you see the outcome is still, we are remaining, it is the same, We have not been able to have a good outcome overall. Until the cancer has been diagnosed in early stage, then it's a different scenario.
Perplexing thing is, two set of people doing bad things. One gets cancer, one doesn't. Two set of people doing good things. One gets cancer, one doesn't. So there has to be something that we haven't discovered yet.
Yes.
God willing, we find it.
Hopefully, but yeah, there are could be possible because of HPV virus. We don't know.
Yeah, that's possible.
Because it's not a trend in India still to sequence all the tumors that go. So you never know. So possibly could be HPV virus, could be genetic predisposition. Maybe you said that she mustn't be in habits now, but possibly it could be that she must be in habits before.
Nothing. Never had tobacco. Never smoked. No history at all. So, I think cancer is a very complex disease, and there could be a combination of things which we still do not know about. One thing I do know that I was reading about was they had done this test on hamsters and mice and done some studies where they injected a few with carcinogens. All of them they injected with carcinogens, and a few of them were kept isolated in their cell, and the others were petted and loved and hugged every day. The ones who were petted, loved, and hugged every day did not let the carcinogens become cancer. The others who were left by themselves, their disease, manifested as a full-blown cancer. So, is it something that we are doing with, our relationships, the love, the bonding that prevents people, like when we say few doing it and get it and the others doing it don't? So there is something out there that's still to be thought of, but these are right tests that are happening to prove that the hug, the sharing of love, bonding can prevent you from a lot of diseases.
Dr. Pranay, when we say oral cancer, are you going to segment the mouth into parts. So, which part of the mouth most commonly have you seen getting cancer, and which part of the mouth you've not seen? It doesn't happen, or it happens everywhere.
So no portion of the mouth is spared. However, the tongue, the buccal mucosa, and the GB sulcuses as well as other most
What
common
do you mean by
sites.
GB sulcus we are talking about?
Yeah, so the GB sulcus is like the buccal mucosa and the jaw in layman language. If you talk
Yeah.
about is the jaw and the buccal mucosa and the tongue are the most common sites for your oral cancer. And the most uncommon site would be the palate,
Soft palate, hard
yeah, the
palate.
posterior base of the tongue, floor of the mouth. These are like not very commonly occurring cancer.
So, does the taste start to alter if they have the beginning of cancer? Do they feel a change in their taste? Suppose it's a cancer of the tongue.
Yeah.
Would they be able to identify there's something wrong? They can't taste something?
If there is cancer of the tongue, the first and foremost would be they would find it very difficult to chew or eat or take any sort of food
Like
because it would,
mobilize the tongue?
yeah, the mobility would be affected. Secondly, the burning sensation would be there so severely because it would be ulcerated. And even a little bit of spicy food they will not be able to consume, and speech is hampered, and so a lot of things, like this. There will be some amount of bleeding happening from that wound which has happened, and yeah, these are a few things,
What
which,
are the other symptoms that a person should look out for?
so
Like, are there some tests one can do at home or something that they look into their mouth every day to see?
so I feel if you feel that there is any small amount of ulcer which is not healing for a long time, or there's some sort of bleeding happening in your mouth, or you're finding that something there's immobility for you to move your tongue or your jaw, or for that matter, you feel anything has become hard and indurated, when you touch that area, then there should be something to worry about.
So, moral of the story is visit your dentist regularly
Absolutely.
and make it a habit to. Uh, it's not like self-breast examination that you can do at home. You need somebody to do it for you. So, visiting a dentist should be part of your medical routine and part of your life. It should become essential. I think that's the only way you can diagnose early. And early diagnosis is the secret of success in any kind of cancer.
Absolutely.
So
Because
once
earlier we diagnose, lesser is the treatment, better is the outcome.
Yes.
The survival rate is almost 80 to 90% in stage 1, stage 2 cancers.
Since we're talking of outcome, do you think there's any possibility of getting these oral cancer treated, like we know as treated?
Yes, definitely we can treat these oral cancers. And the only drawback in our scenario we feel is that till the time cancer comes to us on table, it has already reached stage 4. So
there's no screening done.
So
yes,
these people
so
haven't been to a dentist.
exactly,
A good trained dentist would pick up cancer at a very, very early
very early
stage.
stage.
Dentists should go to places where they're habitual users and do screening. Free screening.
Yeah.
That's part of it.
We do have the brush biopsy. What do you have to say about the brush
So
biopsy?
brush biopsies are a good way or modality to diagnosing mass, where we are doing mass scans. However, I personally feel that biopsy remains still the gold standard.
Yeah.
And brush biopsy screening for people when we are doing cans and all, it's very good to diagnose that there is some sort of dysplasia or present in the patient. Then we can screen them, take the numbers down, and then targeted we can do a punch biopsy or a excision biopsy for these patients.
Great conversation. And I think on our next session, Doc, we'll talk to him about the treatment modalities.
Treatments and success rates.
Yeah, absolutely.
It's scary.
Yeah, it is, man, because I hope.
But a disfiguring kind of cancer.
Yeah, this is the disfiguring kind of cancer, because if you see, the face takes everything from you. It's what we talk about is your face value. People look your face first. Okay, so if your face is disfigured, it takes away your confidence. It takes away your personality. What you stand for.
Also, your chewing gets affected. So
Yes,
your food consumption changes.
Yeah, that's what I was coming to. Your health overall gets affected because your diet gets affected indirectly, because mouth is the area where you put your food from.